optic tract lesions, occipital lobe lesions. So you should know what kind of the defects are there. Okay, let's revise with me quickly, beta. So the A visual field defect, you will get this visual field defect when there is optic nerve lesion. Optic nerve lesion. Okay, this will be seen in the lesion of the optic chiasma, which we just discussed, bitemporal hemianopia. Okay, this will be seen in the lesion of optic tract, homonymous hemianopia, which will be contralateral. So if there is left optic tract lesion, the homonymous hemianopia will be right-sided. Okay, this will be seen in the parietal lobe lesion, pie in the sky, pie on the floor, parietal lobe lesion. Okay, this will be seen in temporal lobe lesion, pie in the sky, superior quadrantopia. All these will be on the contralateral side of the field loss. Okay, and this will be seen in occipital lobe lesion. What you are noticing over here is there is homonymous hemianopia, but the central area, the central part is spared. We call it as macula sparing homonymous hemianopia. Okay, so this again, beta, I will not advise that any one of you should you miss this. At least remember, even if you remember this chart, you should be able to solve the visual field question. Okay, beta, right? Okay, guys, moving on to the next question. A factory worker has got lime falling into his eye accidentally. He's brought to the eye emergency. What should be done immediately? A factory worker has got lime falling into his eye accidentally. He's brought to the eye emergency. What should be done immediately in this case? So again, guys, the trauma-based questions are very important for you. A factory worker who has got lime falling into his eye is brought to the eye emergency. So what are the options with us? Do slit lamp examination to assess the injury to the cornea. Bandage the eye to provide pain relief. Do thorough irrigation of the eye with double eversion of the upper lid. Test the vision as it is medical legal case. So what should be done in this case? What should be the first or the immediate step in the management? Okay, guys, I'm waiting for your answer, beta. Okay, so those who are marking C as the answer, they are right. Okay, lime is going to cause alkali injury, beta. Lime is going to cause alkali injury. What you want to do is to wash the eye of any residual chemical before doing anything. Okay, even you will do the vision assessment, slit lamp examination later, because the first step is no, beta. A is not the right answer. A is not the right answer. The first step for chemical injury, please remember, do not forget this. The first step for chemical injury is thorough irrigation of the eye surface. Okay, why do you want to do the thorough irrigation? Because you want to wash any residual chemical from the eye surface, otherwise it will keep on doing the damage, especially the alkalis. And you will do the double eversion of the upper lid. If there are any hidden chemical particles under the upper lid, they should also be washed. Okay, right? Okay, so C is the answer, beta. C is the answer. Once you have done that, then of course you will do the slit lamp examination to assess the injury, and then you will start the patient on medication, whether the bandage is required. The medications which will be needed will be antibiotics, there will be steroids given, there will be vitamin C given, there will be citrate given to promote the healing. But the first step is thorough irrigation, and it is advised to keep on doing the irrigation till the pH of the eye surface becomes physiologically neutral. Okay, so all of you are clear about this question, beta? So whatever is available, beta, ideal is BSS solution. Okay, BSS is most of the time is not available, so Ringer will be the preferred choice. But if nothing is there, you can do even with saline, but irrigation should be done. But preferred is BSS or Ringer. Okay, right. Moving on to the next question, beta. Identify the dye and the structure stained in the procedure shown in the given image. Okay, so have a look at the image. Have a look at the image, and you have to identify the dye and the structure stained. Okay, so let me enlarge the image for you. So identify what is the dye being used here and what is this structure which is being stained. Okay. ठीक है, सुन लिया, ये देख लिया बेटा आपने. Now coming to the choices. Sodium fluorescent dye and cornea. Okay, so you are using sodium fluorescent dye and staining the cornea. You are using methylene blue dye and staining the lens capsule. You are using methylene blue dye and staining the cornea. You are using cobalt blue dye and staining the lens capsule. Hanji beta, what is your right answer? Yes. Okay, the B is the right answer. Very nice. B is the right answer. The dye which is being used here is methylene blue. The dye which is being used here is methylene blue, and the structure which is being stained here is lens capsule beta. ठीक है, एक बार मैं आपको दोबारा image दिखाती हूँ. So this is the procedure of capsulorhexis. Okay, this is the procedure of capsulorhexis or capsulotomy in cataract surgery. And you see here the cataract is white cataract. So when the cataract is white, when the lens is white, you are not able to see the lens capsule very clearly to do the capsulotomy. So you have to stain it. And the dye which is used to stain it is methylene blue. So it is the lens capsule which has become stained. And since now it is blue, so you can easily peel it off to make an opening in the interior lens capsule, which is called as capsulorhexis. Okay? So this is methylene blue dye which is used to stain lens capsule for capsulotomy or capsulorhexis. ठीक है, B ही है बेटा, B लग रहा है और वही है. ठीक है डॉक्टर सैनी, you are absolutely right. And just to kind of refresh your memory of how the fluorescent dye will stain the cornea. So this is the fluorescent dye, sodium fluorescent, which is used to stain the corneal epithelial defects or the corneal ulcers. So that dye, when it stains the cornea, the dye appears, the stained area will appear green in color, and this is viewed under cobalt blue filter. ठीक है बेटा, right? Okay guys, moving on to the next question here. Name the muscle. Again, the extraocular muscles are lately the favorite with the examiners. Name the muscle used in the right eye for the movement shown in the given image. Okay, so first of all, see what is the movement which is in the given image, and then identify the muscle used for the right eye. Okay, right eye beta. First of all, what is this gaze? Now this is the, and then identify the muscle used, movement shown in the given image. Okay, so first of all, see what is the movement which is in the given image, and then identify the muscle used for the right eye. Okay, right eye beta. First of all, what is this gaze? Now this is the left eye of the patient, this is the right eye of the patient. Okay, both the eyes, they are looking like this. So they are looking towards left side, left and up. Okay, they're looking left and up. So we call it as levo elevation. This movement is called as levo elevation. Right. So what is the muscle in the right eye which is being used for this beta? Muscle in the right eye. Is it right superior oblique? It is right superior rectus, right inferior oblique, or right lateral rectus. Okay, थोड़ा सा tricky question है, थोड़ा different तरीके से I have kind of formulated it, but easy है. Don't get confused. Which muscle is being used for the left eye? But this is a normal. There is no palsy. I'm not talking about the palsy. I'm just telling you, if you move your eyes left and up into the levo elevation gaze, which is the muscle your right eye will be using to go to that gaze. Yes, I'm very happy. Right inferior oblique is the answer, beta. Okay, so doctors, please, this is not something fancy or something, just the normal gaze. So there are 9 cardinal positions of the gaze. For those positions in each eye, there is a specific muscle which is used. Okay, for levo elevation, for this particular movement, left eye you are using superior rectus, the rectus on the same side, and oblique on the other side. So these are the, we call them as, if you remember, yoke muscles, beta. We call them as yoke muscles, the muscle in each eye which is moving both eyes to the same direction. Very nice, very nice. Okay, so on the same side of the gaze, that is on the left side, the rectus will be used. So left superior rectus, and in the right side, inferior oblique will be used. So they can ask the question in both ways. They can ask you to name the yoke muscles, or they can ask to name just muscle in one eye, as I have told you. Yeah, both have for elevation. No, not right superior rectus.